button anymore. Oh, it's now it's being recorded. Who pushed that? I didn't push the button. Okay, I'm getting more functions as it's getting.
I started it, Kasang. This is Salome. I can bring it back to you guys when it's done, if it comes to mind.
Oh, excellent.
Thank you, Salome.
Sure.
That's great, Salome. So we have a minute before we click record, and my electricity has come back up, and I think I'll be in the room in exactly 20 seconds. So just to double check again, is the presentation up? Is everyone able to see it? Yuka?
No, I don't see a presentation.
Yeah, it's gone down now.
Okay.
Okay, while we're waiting for the presentation to load up, and in case there's an issue, Song, I can do it from here.
I'm going to try it again.
Okay, great. And a very warm welcome to everyone who's on the line today. Welcome to the June 2018 Fresh School Health and Nutrition webinar. This is Mohini Venkatesh from Save the Children. The Fresh webinars are a series of monthly presentations on school health and development in low and middle income countries, jointly organized by Fresh partners. Each month, we commemorate a special health day, and to speak on the health topic, we bring in researchers, policymakers, and practitioners to share their knowledge and experience. And this month, we are commemorating the 71st World Health Assembly, which recently took place in end of May. As many of you know, the World Health Assembly is the highest decision-making body of the World Health Organization. And this year, delegates met and agreed on an ambitious new strategic plan for the next 5 years called the 13th Global it's called the GPW. You'll hear more about it. And it's designed to achieve the Sustainable Development Goals with a target called the triple billion. And today we have speakers from the WHO and the UNESCO Chair for Global Health and Education, who are here to educate us more on the 13th GPW and what this means for health promotion and health promoting schools, and the renewed direction that this new era of the SDGs brings to the health promoting schools. Now to introduce our very special guests for today. From the WHO, we have two speakers, Dr. Faten bin Abdelaziz, who's the coordinator of the Health Promotion Unit at the WHO. Dr. Faten has been in this position since 2016, and prior to this, she was the regional advisor for health education and promotion at WHO EMRO for Eastern Mediterranean region. Joining her from the WHO is Dr. Yuka Makino, who's a technical officer also within the same unit. And Yuka has been in this position since 2016. She comes with many years of experience in school health and oral health, particularly in the Southeast Asia region. From the UNESCO Chair for Global Health and Education, we have Professor Didier Jourdan, who is the current incumbent chairholder from the University of Clermont-Auvergne in France. Professor Jourdan's research focuses on public health policies and interventions. He's a member of the Scientific Committee on Schools for Health in Europe network, the SHE network, and has contributed to health promoting schools in Europe, the Mediterranean region, and Western Africa. Joining him is Buijs, who is the manager of the UNESCO Chair. Dr. Goof comes with 35 years of experience in promoting health and education. He is also associated with Schools for Health Consultancy in the Netherlands and has worked on health promoting schools in the Netherlands and in Europe for several years now. I would like to hand it over to our speakers, starting with Dr. Faten, followed by Goof, then Professor Didier and Yuka. Welcome, Faten, can you hear us?
Hi, Makino. Thank you very much for the introduction. Just checking with you again, we don't see the presentation on the screen. So would you like us to still wait until we see the presentation, or would you like us to move to the computer and then follow up with you using the next option?
It should be showing up now. And if it's not, I would recommend perhaps opening up a local slide, and when you would like to move to the next slide, to just say next, and we will move it to the next slide for all of our participants to see, to be on the same slide as you.
Okay.
And I would request all the participants to stay muted through the presentations and to type in any questions during the presentation into the chat box. Also, please introduce yourselves in the chat box with your name and organization. Thank you, and over to you, Dr. Faten.
Mohini, I just want to double check I just want to make sure that everybody else is seeing the presentation. It's not just in the chat box and the conversation. Everyone can see that. Okay, great. Thank you. And I will, listen to you and move those slides forward.
Okay. So shall I go ahead?
Yes, please.
Okay, so good afternoon, greetings from Geneva. This is Faten Ben Abdelaziz. And in today's joint presentation, as Mohini mentioned, it will be composed of 4 speakers. I'd like to thank first the organizers for the opportunity to present on the work that we do here at WHO headquarters under the Unit of Health Promotion. So today it will be about upscaling health promoting schools in the SDG era. Slide 2. So again, we all know that there is a strong interconnection between education and health. You need health to achieve education, and you need education to actually ensure that your health is protected and promoted. Next slide, please. So today's outline of the presentation will be composed of a background so that we all know where we are coming from. It's important that we all have some basic common references to understand where we are actually, the rationale for the activities that we are proposing. We will also, as Mohini mentioned, present before you some of the priority agenda items for WHO, so that you also have an idea of the context in which we are operating. We'll have a presentation on the requirements and the opportunities and the different initiatives in the European region with regards to upscaling this initiative of health promoting schools, and what are the requirements for moving forward this very important work. Next slide, please. Next. So before moving on to, again, talking about health promoting school initiative, we selected here some few indicators that we wanted to present before you so that you also have an idea of the current emergency at global level. Well, data from 2015 show that over 3,000 adolescents every day die of mostly preventable or treatable causes. If we look at the adolescent boys, a major cause of death is linked to road traffic injury. If we look at the causes of death for girls, they are linked to maternal or reproductive health or self-harm causes. Next, please. But there is also a very alarming element when we speak about the health of adolescents. Obesity is now one of the major causes of ill health and morbidity among youth. Obesity, as you know, is the causes of type 2 diabetes and heart diseases. And we know that more than 60% of children, obese children, will remain obese adults. So there is somehow an emergency now with relation to NCD prevention when we speak about the health of children and adolescents. Next, please. Why is it crucial to have this collaboration between education and schools? Well, school settings have host more than 90% of children of primary school and over 80% of children in lower school. So these provide platforms for ensuring that the health of children and youth in general are protected. We know that initiatives that are triggered or implemented in school settings trigger some positive impact or have some positive impact on the students. We know that students spend a long time of their days in the school setting. So this is strategic to promote some healthy behaviors, some basic knowledge and experiences to promote what we call, and we try to avoid that now, the concept of healthy lifestyle. But the schools also have a critical role in promoting healthy communities. The schools are actually strategic links between not only the student's life and it also has a strategic link with the community and the families. Next, please. This is a slide that we wanted to add just to give you again an idea of the key milestones in developing the Health Promoting Schools initiative. But I will only start these key milestones in 2000 when there was a major agreement between the United Nations organization where they actually signed the Focus Resources on Effective School Health, the framework. Following this agreement, in WHO, we organized 2 key meetings, technical meetings. The first one was to look at some key features of what we call the health promoting school. The second meeting was to look at, again, some of the elements of the implementation gap. Next. With regards to the key feature of the health promoting schools, we at WHO, and I'm sure that that's the same in other organizations who are looking at school as a major, or education as a major sector in promoting health, that promoting health doesn't stop within the premises of the school. You need to engage the health education and community leaders to ensure that what is taught or educated in school settings is not lost when the child goes back home. You need to provide a physical environment that is safe for the children. You need to educate or induce in the specific or life skills education among individuals so that they can themselves have this autonomy that is required to keep your health. Of course, you need to have some health services providing in the school settings. This is what we consider as an expansion of primary health care or universal health coverage. You need to have in place the policies and programs that will sustain, again, this environment of health promoting school. But you also need the community. So we take the health of the students in its ecosystem and not only within the premises of the school. Next, please. Looking at the implementation gap, what was observed in the countries where this initiative has been implemented. There are a number of, again, challenges that this initiative is facing. The first one is, of course, a clear identification of a person at national level who could promote this concept. Not much resources are also attached to this initiative that would permit, again, programs or projects taking place in school settings. There is also a major challenge in working across sectors. When we developed this initiative, the language was actually different. What we defined as being, let's say, a project, an indicator, or achievement was sometimes understood differently from the other sectors. A major limitation for this initiative was mechanisms for monitoring, evaluating impact, performance, but also accountability. And as you all know, these elements are critical for ensuring political support. Next, please. Next. So, as you all know, and I'm sure it is reflected in all of your work when you talk about health education, this initiative supports six SDGs from Agenda 2030, amongst others. And in the JPW that Mohini mentioned earlier, we have defined key areas where these initiatives can provide, again, visible support. Next, please. Mohini mentioned about that this year we celebrated the 70 years anniversary of WHO. Within this, member states have also endorsed what we call the General Program of Work, number 13. This General Program of Work will guide the work of WHO for the coming 5 years. 3 strategic directions were identified, the triple billions, as we call them. But the work of health promoting school falls very much under this 1 billion more people enjoying better health and well-being, this healthier population. So in order to achieve or to work on these strategic directions, some targets were identified that are outlined in this slide. And this is what we hope this, again, this initiative during the coming years will contribute to or will focus on. Next, please. So in light of the Agenda 2030 and in light of the JPW 13, here at WHO headquarters and under the Health Promotion Unit, we have developed two key projects. The first one is the development of a life skill education package, which focuses on non-communicable disease. In my introduction, I mentioned to you about the issue of NCDs and related to obesity, but also related to tobacco, the use of tobacco products, as well as substance abuse. Together with colleagues from the other units at WHO and other partners from the United Nations Organization and experts in the area of health promoting school, we are now starting a project called the Development of a Global Standard for Health Promoting Schools. This project comes as a request from member states, but it also looks at a need that was the need to have some sort of common understanding, common values, common ways of for assessing performance of this very important initiative. Next, please. So now I'll hand over to Professor Jourdan and Professor Goof for their section of the presentation.
Okay, can you hear me, Mohini?
We can hear you fine.
Yes,
Okay.
Goof. Over to you.
This is Buijs, and welcome from Amsterdam, with maybe some sound of trams on the background. I hope this is not too disturbing during my talk. and I speak as currently as manager of the UNESCO Chair Global Health and Education, and I will share some of the experiences that we have with the cultural and different contexts on developing and implementing health promoting schools in the European region. Next slide. As you all know, the SHE network has been operating since 1992. It was actually mentioned previously in the slides of Dr. Faten as one of the key milestones, the start of the European Network for Health Promoting Schools, which is now SHE network. And in more than 40 countries in the European region, there are national health promoting school programs. We have national focal points, and they work actively on developing and setting up national programs in health promoting schools. What we have been able to do since 1992, and I think that is very crucial in our work, despite all the huge differences and situations in all the countries in West, North, East and southern parts of the European region, we have developed a shared set of what we call SHE core values and pillars. And also we had a number of European conferences on health promoting schools resulting in policy statements. And I would say that we have been emphasizing for ever since we started the relevance of intersectoral working, having the health and education sector working together. Next slide, please. And we did a survey in 2013 among our national coordinators. These are the focal points for the SHE network and have been appointed jointly by the Ministry of Health and the Ministry of Education. And in our survey, we identified more than 34,000 schools that identify as health promoting schools. And you can see in the figures that a huge variation, in the number of schools per country. So some countries in the European region have all schools identified as health promoting schools, while I would say in most countries it varies between 2 to 10%, and some countries do not have health promoting schools at all. Next slide, please. And we also, in that survey, discovered that about 2/3 of the European countries have a national health promoting school policy, which is part of the education policy. I think that's an interesting find. Also, we find that there are very different education systems and cultural contexts in the European region. And I would also say that we have mainly high and middle income countries in the region. We also seen that health education as in the curriculum is mainly integrated into other subjects, 62%. So I would say about 40% of the schools of countries have health education as a separate topic. Next slide, please. So I think for the SHE network and also for the European region, the Paris Declaration, which was the result of a high-level conference organized by the World Health Organization for the European region, together with UNESCO and UNICEF, which was held in the UNESCO headquarters in Paris. The result was the Paris Declaration on promoting the health and well-being of our future generation. And I think that conference was quite pivotal in, again, emphasizing the importance of collaboration between education, health, and social sectors in making our work more successful. The declaration also states that every school in the European region should be a health promoting school, and also to use the existing networks, including the SHE network, to do this. And a final point is strengthening monitoring and evaluation of policies and strategies. Next slide, please. I'll now give the floor to my colleague, Professor Didier Jourdan.
Thank you so much. And thanks to the colleagues of the French collaboration and from WHO to give us the opportunity to give you ideas about the way in which research could help to upscale and to support the changes in the health promoting school. Just a couple of words. UNESCO Chair, it's a part of the UNITWIN network. It's a big program of UNESCO, and we have just created a UNESCO Chair called Global Health and Education. Next slide, please. And this UNESCO Chair have the characteristic as being clearly based on research teams. At the time, there's 70 universities involved, and there will be more because we are just at the beginning. Not only North and West, but also East and South, which is very important. This is what I'm going to explain a little bit later. The aim of a UNESCO Chair is to contribute to knowledge base, knowledge dissemination, and capacity building. This is just the core business of university. But by working together and having with us colleagues from low-income, middle-income, and high-income countries on all the continents make possible a kind of change of paradigm. Instead of thinking we have a single model of health promoting school, the idea is to work with and on the research made in the different countries, in the different cultures, and in the different contexts to move forward together. And the other point of the UNESCO Chair is that it's a kind of service for the UN agencies and the existing network. Next slide, please. So for the next generation of standards, the next generation of training program, and the next generation in general of health promotion, what are the key issues from the point of view of research? The first one, it's linked to the paradigms themselves and to the ethical issues linked to health promotion in schools. And one of the most important way for the research in the future is to work on the context, and this is what we are doing and what people are doing in many countries. It's taking into account the culture of the school system, the culture in general of the society, and not only the socio-economical context, because of course what happens in schools is directly connected to what happens in the society and what is and what are the different models, the different cultural models. And the idea of this dimension is to try to move forward in terms of being more culturally sensitive health promotion in schools in order to have a better idea of the impact of having, as an example, a very decentralized or a very centralized school system, having a school system very embedded in the community or not embedded in the community. And this is absolutely critical to be able to promote on a global level the health promoting school approach, not only in very few private schools in the different countries, but in every school. The second very important avenue for research is the question of the knowledge base and the data we can collect from intervention research initiatives. And the last one is about understanding the implementation process. It's always taking together knowledge production and knowledge transfer. And when we say knowledge, it's not only scientific knowledge, it's also community knowledge, it's also individual knowledge. We have to consider with equal dignity. And if you would like to forward to the next generation of health promoting schools, we really have to be able to take together all these knowledges. Next slide, please. So in terms, yes, please. The idea now is to move forward from, on the one hand, the traditional prevention and the traditional health promotion with their own characteristics, and to see in what way we can develop a view, a renewed view of the research and also the practices in relationship not only to the opposition of the traditional top-down prevention and the traditional bottom-up health promotion, but to try to create a new view, more comprehensive and able to take together prevention and health promotion, which has to be focused on the determinants and on the context. And again, the question is always the context and the cultures. And so the work done at the time in the field of research is to try to define more and to promote a view of what we call health promotion 2.0, based not on the opposition of top-down and bottom-up, but more on the dialogue between the two of them, since it's impossible to only have bottom-up or top-down. Working not only focused on experts or on users, but more in a co-creation process, forgetting only the approach limited to school, and this is also what Faten Ben Abdelaziz just said, but an approach we call supersetting, meaning the school and the other settings, using qualitative and quantitative research, complex interventions, and taking together health outcomes and more social and well-being outcomes. The interest of this approach is to move forwards in terms of capacity of production of evidence, because we really need to strengthen the evidence base, and the idea is to try to make it more understandable, more relevant for scaling up and for generalization, but also strong enough to support the development of health promotion in schools. Next slide. The third idea is the development of intervention research based on the 4 principles you have on the slide: participation, co-creation, positive and broad health concept, and empowerment and action competence, and setting in synergy, in order to have not only data coming from research in the US or in Europe, in a couple of countries, in Japan and in different countries, but to have strong intervention research protocols in the different countries, in Africa, in Central Asia. This is what we are working on at the time, to work on the indicators in the different countries in order to have more indicators that fit more with the context and with the cultures, based on the work of some colleagues involved in the Chair, and especially the team of Albert Lee. Next slide, please. And the last thing I would like to highlight in this part of our talk today about how to upscale and support the development of health promotion in school is the global work on the implementation process. At the time, most of the research are focused on the fidelity to a program implemented in a community and in a school, and we probably now have to be focused more on what this program becomes in the real life, in the community, or in the school practices and policies and in the real life. And there's now a very big commitment for research on the implementation and what we call the enactment process, because it's never an implementation, because all community and all school reinvent the way in which they are health promoting schools, depending on the context and cultures. And the idea now to move forward is to move to a better understanding of the context, and then to develop patterns of implementation of the health promoting school model to different countries, different contexts, different regions, and different culture. Next slide, please. The idea then, this is just an illustration of what I said, is to take together the process and also the impact of the different programs. So finally, just to conclude for this part, at the time research more focused on the ethical and the definition and the kind of health promotion in school we could have in the different contexts, especially in Africa, in Central Asia, and in South America, in order to nourish, to nurture, to gain from the research in these different countries and researchers in the different countries to help our model to move forward and to improve. And the other points are to work on global intervention research in order to have a more comprehensive view of the results and the difficulties and the levers, and finally about the enactment process. Okay, now Yuka, it's your turn. Next slide, please.
So thank you, everybody. Can you hear me? This is Yuka. So from now on, I'd like to talk about how we can move forward these health promoting school initiatives. Next slide, please. According to the current SDG era, the SDG provide a unique opportunity for addressing health and its many determinants in an integrated and transformative way. For improving health, we have to consider whole sector approach. According to the WHO GPW13, 3 key strategic areas ensure healthy lives and well-being for all at all ages and influence on actual country context. As Dr. Faten mentioned, health promoting school is one of priority area of work in WHO school health work. However, there is lack of a common performance indicator to support progress assessment of health promoting school. Moreover, countries express their needs to have those common performance indicators. According to the Dr. Goof's presentation, the School Health European Network experience health promoting school policy in most cases as a part of their education policies rather than public health policies. The view on health and health promotion in school setting actually differ widely within and between countries. There can be a misperception of health by the education sector, but also a misperception of education sector by the health sector. In order to move forward the health promoting school, we need to take diversity of the relationship between education and health in the different country and region into account. As Dr. Didier mentioned, needed to consider implementation process as well as the context to develop the standards is required. Next slide, please. Therefore, in collaboration with UNESCO Chair, WHO have been engaged in development of standards for health promoting school. The standard is guided by the 6 key features for health promoting school to provide guidance on key action required to establish and run a health promoting school as a setting while considering the ecosystem of child and adolescent environment. Next slide, please. In order to adapt an intersectoral point of view, standard for health promoting school should take into account the educational culture, such as organization of school system, relationship between school and community, and level of the schools of decentralization, and the context. The context means high resource and low resource and emergency due to the conflict disaster that depend on that context. And also the development of the process of this standard will be, as you see this slide, expert at a global level with a balance between people from the different countries who participate in this process. The contributors should be from the education and health sector in order to ensure the comprehensive standard for all the stakeholders and the civil society. Then the evidence-based knowledge and the experience of the experts in the different regions will be taken into account together by our process of literature review and consultation. Next slide, please. So this is a conclusion. So health promoting schools have a positive effect on range of student health outcome. However, there is lack of a common performance indicator to support progress assessments. And as you know, there is a gap between health and education sectors. In order to develop the standard for health promoting school, it is important to consider context and different systems as well as implementation process. Indeed, the current era means the SDGs and also GPW13 is a good political support to scale up health promoting school globally. Therefore, the WHO are going to process of development of the global standard for health promoting school under collaboration with the UNESCO Chair as well as under UN agencies. So next slide, please. So thank you very much for your kind attention.
Thank you so much, Yuka, and Thank you so much, Dr. Faten, Dr. Goof, and Professor Didier for your presentations. You've given us all a lot to think about, and hearing about the new developments at the WHO, as well as at the UNESCO Chair and your priorities, really is the kind of leadership that we're all really aligned to in terms of refreshing and renewing health promoting schools, and across the UN and other organizations, development partners. We follow the same framework of ensuring children are healthy to learn and that they learn to be healthy, ensuring there are those basic elements in place, whether it's called the 6 key areas of work for health promoting schools or the 4 pillars of FRESH and its supporting strategies. The push really for this in this new SDG era is to have clear standards that are achievable, attainable, and if I can use the SMART acronym, all of those elements from being very specific, realistic, and target and time achievable. We have some questions here in the chat box that I would like to read out. First of all, I mean, and this is coming from the first presentation by Dr. Faten on the global standards. If you could share with us what is the current thinking around developing the standards for health promoting schools. There's one, of course, you know, the need for ideal standards for what a healthy school should look like, and the realities of a developing developing country context or a low-income context makes even those basic standards hard to achieve. Learning from what's happened in the European region, where there is also a lot of diversity across countries, like Scotland having achieved 100% coverage, but others still needing to go a long way. Is it going to be one standard to fit all contexts, or are you looking at it in a more layered approach?
Thank you very much, Mohini, for the question. Yeah. So regarding the standards, just to I understand that very often we kind of assume that every time when we speak about standards, we speak about gold standards. This is not the case. When we had our internal consultation here at WHO, consultation with the experts and consultation with colleagues from the other UN agencies, the feedback was that having minimum standards we thought of core requirements, minimum standards, again, norms. And the view was that minimum would be badly or negatively perceived by countries with low and middle income countries. It would be associated with the concept of stereotyping. So standards refers to minimum standards, expanded, and comprehensive. So we'll have different categories of standards so that we will not, again, how can I say, we will not hinder the work that some schools are doing to be, who have many means and many assets to provide an excellent school environment. And we will also not somehow disregard the efforts that are being done with schools that have low settings. And I would like to just mention that because this is also associated with the idea of high income and low income countries, it's very important when we discussed with experts and colleagues here that low resource setting school settings is not only in low and middle income countries. You can be a high income country, but you're dealing with a school that has actually very limited resources, very limited investment in the promoting school initiative.
Thank you so much, Dr. Faten. I see Goof has his mic unmuted. Goof, would you like to add to that? And I see there are comments also in the chat box from colleagues adding additional perspective to what you said, Dr. Faten. Goof?
Can I add to what Dr. Faten has said, some of the experiences we have in the European region? As I said, we have huge diversity here, and one of the activities that we have been doing very much is to support schools in implementing health promoting or whole school policy well-being, and developed support the implementation process forward. And I recently finished a pilot project
Hi, Didier. We're having a hard time
more way, I would say,
hearing you.
as the high and underpins. This underpins the relevance of making requirements that also to innovate in the process of improving and self-improvement.
Oof, can you repeat everything you just said? Because I couldn't hear you. Maybe you're better connected now. You're breaking up. Hello? Oof.
Goof, perhaps you could type if your sound is not working properly at the moment, and unmute when it's back up again. Does that sound okay? If you could type into the chat box, we'll know that you can hear us. Okay.
Mohini, I think the connection went off, but I can see that there is one comment on the side referring to ABC categorization. And it's a nice coincidence because when we were working with the different colleagues, the implementation aspect of these standards is called the ABC. So I would like to thank Leonel Arguello, who actually referred to the ABC. It's actually what we are working on. Thanks.
Oh, that's fantastic. That's an excellent coincidence, or perhaps a great example of there being synergies at different levels. I also wanted to read out the comment from Song on how the initiative that is being chaired and led by the WHO would link with other initiatives that we're seeing for specific thematic sectors by other UN agencies, for example, with UNICEF and the WHO, child-friendly schools and wash-in schools initiative, where they've come up with similar the standards or levels for achieving a healthy learning environment with respect to water, sanitation, and hygiene. And likewise for nutrition promoting schools and the work that's happening in the UN agencies that promote nutrition education, FAO, WFP, and the others who may be developing similar benchmarks or standards. How would these different thematic initiatives link up? Has there been some work around that or thinking around that at this point, or is that to come in the future?
Okay. Shall I go ahead in answering?
Yes, please, Faten.
Thank you. So as I mentioned in the beginning of the presentation, I know I mentioned it very briefly, but so we have several units here at WHO involved in this project. So for instance, we have the Adolescent Health, we have the Department of Nutrition, we have the Department of Blindness and Injury, Child Health. So these different units within WHO will make sure that whatever standards they have actually recommended will be covered as well in this initiative. For each of the UN agencies, there was a focal point identified, and the role of this focal point is to make sure that whatever recommendations the respective organizations are actually making are also included as part of the project. So it is really the way this project was, the basic structure of this project is to ensure that within the UN agencies, the work that has been done in terms of recommendation and normative work is covered. But we also, and this is where the role of practitioners are very important, is those involved in the field work. So it's research, but also field work informed, are also have an area to contribute to, because they will also bring a reality check. So we are not looking at a full inventory of what's happening in the area of health promoting schools, but we are looking at effective interventions, those that have demonstrated impact in terms of education achievement and health achievements and health outcomes. Thank you.
Excellent. And there are a couple of other comments here saying several of us, this is from Mary Pat Kiefer, who says several of us are working in this space across different countries and welcome this global initiatives to bring us to the next level. How can NGOs working on the ground contribute to this initiative? And then there is similar comments here by others, but Dr. Faten, if you've already touched on it when you spoke about practitioners, which includes, of course, governments, NGOs, and others, but would you like to speak more to that? And then we have a few more questions.
So let me go back just to the question very briefly. Mm-hmm. So, well, we count on this kind of platforms and exchange as well. I mean, we work with the different networks and academic partners, but if we could find a way to have additional information about what's happening on the field, and if we could establish some sort of community of practice with regards to health promoting school, that would be very important. Again, as I mentioned, it's a project that is starting, and there will be, of course, an element of learning by doing. So recommendations that may come from this webinar and subsequent communication are more than welcome.
Great, great. And I think there is really a demand or an interest for contributing not only to the development of the standards, but also the evidence base that Professor Didier was talking about earlier. And if there is a means by which we can reach out to the lead coordinators of this initiative, it will certainly bring in that element of co-creation and participation that we all seek to achieve. There's a question here, and I don't know if Goof has his system up again, but another question here on, you know, if we're thinking about the end target, about a of a school being a health promoting school, which aims to meet the basic health needs and goals for children. What are, and this is a question from Sarah Bramley, what are the barriers for achieving that health promoting school status in the European context? And we've heard from Yuka before on some of the challenges in many of the other country contexts in the other regions, but in the European context, what are some of those barriers? Goof, are you there?
Yes, I am. Can you hear me now?
Yes.
Okay. I will focus on the barriers that we find over the years. One important thing is that schools do not like to be told very much by others what they should do. And this is an important issue we've been working with in the SHE network for many years. How can our story, our narrative, be uptaken by the school and integrated in their school policy? And I think a learning is that when we acknowledge the autonomy that schools have everywhere around the world, in different contexts, of course, then I think we are doing much better instead of, as health people, saying what schools should do, because they don't like to be told what they should do. So, and that's why we have concentrated a lot in the SHE network in the European region on the process of implementation, which already is very important in becoming a school that has a whole school policy on health. Thank you.
Thank you, Goof, and that's very interesting and very true that one has to really focus on the process of being consultative and aiming for what is realistic and achievable. So thank you for those insights. And we are just 4 minutes into the end of the hour. But I do want to acknowledge and thank all the comments that we're getting in the chat box here, which shows interest and excitement over the new direction and the priorities for the WHO and UN agencies, but also on the research and evidence side, where the UNESCO Chair for Global Health and Education is taking a lead. So thank you, Professor Didier and Goof, for leading on that. And I'm sure you'll hear from many of us on how we can contribute and add to these great initiatives. And I would like to know if anyone would want to maybe for a minute unmute and add any other points, either from our speakers, Professor Didier or Dr. Faten, before I conclude and make our final announcements.
Yes, just to say, first of all, thank you, Mohini, for all you said, and I really believe that the initiative of WHO gonna lead to a kind of change in paradigm. It's only having one standard, and to say in one way the weakest can have a little bit and the strongest can have all everything. The idea is to try to build something that help all schools and whole countries to move forward from the point where they are. And the UNESCO Chair is really open to the contribution of everybody. It means individual, it means NGOs, because it's always doing research not on people, but research with people. And that's why I really believe in this co-creation process of the launch by UNESCO, by WHO, and the UNESCO Chair are going to be part of this, and everybody can be part of this.
Great, excellent. Thank you so much.
So Mohini, we on behalf of the team also, we would like to thank you again for the opportunity. It's It's very rewarding because we have very pertinent questions that were asked in this session. And so beyond the opportunity of sharing the information about the work we do, it's also very useful and fruitful to receive feedback. So again, thank you for the opportunity and thank you for all the teams that set up the logistics.
Thank you. And thank you to all the FRESH partners who have been working behind the scenes in getting this webinar together. And having 4 of you, we usually do 2 speakers, but it's great to have all 4 of you today speaking from your different perspectives and giving us insights and educating us on what's taking place in the global realm. I would like to thank all our participants for sticking through the technical difficulties we had early on, and for all of the great questions and for the great presentations. As a reminder for those of you who have been following us every month, the next webinar, the next FRESH webinar is on July 16th. It's a Monday, and it will be at the same time, 9 a.m. Eastern Daylight Time. That's in the East Coast of the US. And our featured speaker for that month will be from the Global Partnership for Education. We'll be coming back to you with more details on the topic and the speakers. You'll also be hearing from us with the recording and the presentation from today. We've also shared with you the reading and resources on the topics presented today. So please feel free to look those up and reach out to our guest speakers or to the planning committee at the FRESH Partnership. There's more information that you'll be receiving via email, and you can also see it online on the various sites that are featured. Thank you so much, everyone, and have a good day, evening, and a weekend, and happy Eid to those of you who are celebrating. Bye-bye.